Hello, everyone. My name is Diana Isaacs. I'm an endocrine clinical pharmacist and the Director of Education and Training in Diabetes Technology at the Cleveland Clinic in Cleveland, Ohio. And for this month's Diabetes Sisters video blog, I wanted to talk about ways that you can really advocate for yourself when it comes to medications, ensuring that you get medications for an affordable price and you get the medications that will benefit you the most. In our current system, there are actually a lot of ways to lower your medication costs. Not always, but there are several ways. Whether you have health insurance or you have no insurance or you have a high deductible plan, there's actually a lot of programs that the drug companies have. And so there's a lot of things you can take advantage of, but unfortunately, these things are not always well known. And so that's where the advocacy comes from of you, if you know and you're aware of these things and you can ask for them, you can make sure that you're getting the best cost possible for whatever drug that you're taking. And so I'll give you an example. If you have commercial insurance, so that means you work for an employer, you don't have Medicaid or Medicare, you have like a commercial or a private insurance plan, there are actually tons of copay cards from the drug companies that can help to reduce the amount that you pay out of pocket for your medication. And so, any medication that you're taking, I recommend that you do a quick search online and go to the company's website and see, is there a copay card that you can utilize? Some doctor's offices will give you the copay card, which is great. But unfortunately, the copay cards do change quite a bit. And so they may not always be aware that there's a new copay card out, or they might not have copies of it and all these things. And so by you looking online and seeing, is there one available, often you can print this out and then you can bring it to the pharmacy to make sure that you are getting the discounted price. And depending on the drug, I mean, these can sometimes take it down really, really quite a bit, especially if you have a plan where you pay a little more out of pocket, where you have like a high deductible to start with. These can really often help you to bring that down. So I always recommend you check online and see if that is available. Now, for people, let's say with Medicaid or with Medicaid, unfortunately, you can't take advantage of these different types of copay cards, but there's often a preferred drug on the formulary. And so one of the things that you can ask for is, let's say you're prescribed a certain drug and it's not approved. Instead of giving up and saying, well, okay, I guess like I can't take this drug, there often is actually one in the class of drugs. And so I'll give you an example. GLP-1 agonists have been, I guess, a hot topic. We see them utilized for diabetes and they help a lot with weight loss. And they also have a ton of cardiovascular benefits. So we are recommending these more and more for people with type 2 diabetes. We're seeing them being used off-label for type 1 diabetes. And so this often is a great drug class, but sometimes we go to prescribe one of them. Let's say we try to prescribe, for example, Trulicity, and it gets rejected. It's just that's not the preferred one on that formulary. Well, maybe in the case Ozempic's preferred, or maybe Mounjaro or Victoza. So checking and asking your office, hey, can you try to prescribe a different one and see if that's covered? Also, if you really want to be an advocate for yourself, a couple other things you can do is actually, I know this is like a huge pain, but you can call your insurance company and ask them and say, like, listen, this is the drug class. And you can ask your doctor's office some of the names in that drug class. And you can call your insurance and ask, hey, are any of these preferred? Are they covered? How much would I have to pay for them? So I've had patients do that, and that's fantastic because then they come to us and they say, okay, listen, I know this drug is going to be covered, that one's not. And then we can prescribe the right one right away. And that really helps to make things a lot easier. Now, when it comes to Medicare, similar to Medicaid, they cannot use copay cards because it is a government type of program. Here, we also run into situations where we have the preferred formulary. So also great to call the insurance. We do now have the legislation about the $35 cap for the copay on insulin. Although I am finding that sometimes in the real world, it's not as straightforward as, oh, prescribe any insulin and it's $35. Sometimes there are preferred ones also on the formulary, and that's something that we have to navigate, make sure we're prescribing the right one. And the other reality is that even though it's capped at $35 a month, if someone's taking two types of insulin, like a mealtime insulin and a long-acting insulin, that's going to add up to $70 a month. And so over 3 months, that's $210. And for some people, that's really more than they can afford. And so here we have something called patient assistant programs. And these are fantastic programs that are often available to people that don't have insurance or people that have Medicare that often don't have enough coverage or get into what we call the donut hole. And so this can be a great resource to help cover the medications. And in many cases, they'll be completely covered. Many people are surprised to hear that the income thresholds for those are often much higher than they might realize. So many companies even go up to 400% of the federal poverty line. And so depending on how many people you have in your family, that can actually be quite a significant amount of money. And so it doesn't hurt to complete the paperwork, turn it in, or at least find out what is that threshold. See, would you fit in it, and could you be eligible for this type of program? And then finally, I also want to mention we've had some new, more innovative type of programs. So for example, Mark Cuban's cost savings program, some of the typically more expensive drugs are actually available on there. And so this can be a way to sometimes obtain some more expensive medications at a lower cost. And we are seeing some more and more medications getting added to it. So for example, there's a new SGLT2 inhibitor called Brenzavvy, and that drug now is on Mark Cuban's program for like $48 a month. So that might still sound like a lot of money, but that is unheard of for an SGLT2 inhibitor. That drug class is typically like $500-600 a month. So that's really come down, and it doesn't matter if you have insurance, you can get it for that price with a prescription. So we are seeing more kind of creative ways. There's also some websites called like GoodRx, where you can look up your drug and see nearby pharmacies if it is available at a lower price, cash price. So there are some different ways, but you can see there's a lot of different programs. And unfortunately, your healthcare team may not always be aware of all of the different programs. If you're fortunate enough to meet with like a social worker who knows all these programs and can share that information with you, that is fantastic, or a pharmacist. But if not, I really encourage you to be your own advocate and to look around, ask your insurance company, look online to see if those copay cards are out there, and do what you can so that you are saving as much money as you can, so you can spend your hard-earned money on fun things instead of having to spend it on your medications. So thanks so much for listening. And with that, I hope you all have a great day.